and welcome to Live Life, a Forbes Middle East podcast coming to you from the 4th edition of the Healthcare Leaders Summit. Today joining me is Professor Alireza Haghighi, Chief Executive and Director at Harvard International Center for Genetic Disease, Harvard University, and President of the Advancement Initiative for Medicine and Science. Thank you so much for joining us here today.
It's my pleasure to be here with Forbes.
You've worked at the intersection of genetics, AI, and public health. What's the most transformative way you've seen AI change how we diagnose or even approach diseases?
So modern medicine is one of the most significant achievement of human being. But this medicine that is amazing is still imprecise. It's not affordable. And in many cases, we do have equity issues. So what genomics and AI can do for us is actually to address this. For the first time, we are able to predict diseases long time before any biological changes in the body. That is a transformative change in healthcare. We can predict cancers, some cardiac diseases, some neurological diseases, and based on this risk stratification, we can design public health policy that will improve the lives of millions of people around the world. So that's what genetic and AI can do. On the other side, there are not many non-communicable diseases that we do have a cure for them. For the first time in history, we can engineer our biology. Gene therapy can help us to cure diseases forever. That's a significant achievement as well. When it comes to equity, many people around the world do not have access to essential healthcare services. AI can come and address that in low and middle income countries, in underserved populations. Genomics can come and provide more insight for many patients who otherwise do not have any option or any solution for their diseases. All these changes basically put us in a very special time, basically in history, to improve health and public health.
The Bahrain National Genome Program has become a real benchmark for national health innovation. What lessons or breakthroughs from that project could inspire similar projects?
This needs national campaigns, infrastructure, and also significant partnership between the government, public, private, and academic sectors. So I'm very proud of the team in Bahrain. Now we do have a team that can do the genetic testing. We do have a genetic testing lab in the country. We have trained physicians and scientists for the country. We have developed, and the team actually in Bahrain has developed a large database of genomes of individuals in Bahrain. All this will help the healthcare system, will help the patients there. And the impact of these projects, not only Bahrain Genome Program, but also other projects in this region and beyond, like Emirati Genome Program, like Qatar Genome Program, and other programs around the world, will contribute to improving health, not only within the borders of those countries, and not only to the population, to those populations, but also globally. We're talking about the life science data. The life science data can help us understand biology better, disease, and then help us to strategize treatment and cure for multiple diseases.
How does life science data strengthen a nation's strategic competitiveness?
That's a very interesting question. We are now able to generate significant amount of data about life, which is called life science data. On the other hand, we are able to analyze this big data. I always refer to this as the new currency of power. Data, AI, and intelligence to be able to analyze the data, and the energy that you need to power the intelligence to analyze the data. So these three components are the fields that many countries are investing in. We are in GCC. Many countries, including the country that we are in now, and including the city, Abu Dhabi, is investing significantly in these three areas. And you know that. Emirati Genome Program is one of the largest genome programs in the world, generating significant amount of data on life science. On the other hand, the government is investing in AI infrastructure at the global scale. This country will host the largest data center on earth out of the US. And the third is energy. This is the capital of energy of the world. So GCC has all the three components that I call now as the new currency of power. And that's why that the governments are investing in these fields, because the most valuable data now is life science. It's about life, how we can help people live longer and healthier, right? Whoever has access to more data will have advantage in terms of national development and national growth as well. These are not only healthcare projects. We are talking about national development and growth projects. This will contribute to the economy. This will contribute to the science. This will contribute to the social aspect, social development of the countries. And this will contribute to what we call the strategic competitiveness of the countries.
When it comes to national health programs, success often depends on how scientists, policymakers, and the industry work together. What makes that collaboration actually work in practice?
So the first is the vision of the leaders and the government. That's super important because these are national projects. We are dealing with a strategic data. So the governments and the leaders, their vision and their support is super important, right? And they provide infrastructure as well. So the governments build infrastructure. Academia brings science, analysis, vision and plans, training, education, capacity building. And then we need to partner with industry as well for technology, because we need technology and innovation. And then all this together will build a partnership ecosystem which will lead to the success of the projects. So you cannot remove any of these basically sectors. It needs significant partnership. And if this partnership is formed and works well, you will have a successful project. On the other side, it's super important to educate the population on the significance of this, because you need participation by the population. What is genetic? If they participate, they will not only benefit, but they will help to develop new medicines, medications, drugs, interventions. It's not only about myself. It will help myself, but it will help others as well. If you tell them about the stories of families who do not otherwise would not have any solution for their kids without these technologies, then they would much better understand why this is important. These national projects are important for public health and for patient care.
Amazing. If we were having this conversation 5 years from now, what do you think would be the biggest leap we'd be talking about in genetics and health?
We need to make sure that first, the data is coming from all populations. Everyone should be represented in this data, and everyone should benefit from the opportunities that these technologies are bringing. So my basically best, I would say, significant hope is that we can provide better care first, better, more precise, and more equitable care to all people around the world, and will not be limited to people who are lucky to be born in a country with more services, or to people who can only afford to travel to receive, or to receive better care just because they have like better financial capabilities.
Thank you so much for joining us here today. It was an absolute pleasure having this conversation with you.
My pleasure to be here.